Hello, everybody. I just wanted to announce our noon hour speaker. She's going to be set to start speaking here in a couple minutes. We have Dr. Catherine Trask. She is a Canada Research Chair in Ergonomics and Musculoskeletal Health, and she's Associate Professor with the University of Saskatchewan, and she's affiliated with the Canadian Centre for Health and Safety in Agriculture. She is not a veterinarian, but she is a ergonomist, butchered that, and an occupational hygienist. So not anything to do with hygiene in terms of cleanliness or anything like that, but actually our body health in terms of the physical toll that we take on our body. Thank you very much, and please help me welcome Catherine.
Thanks for that. Thanks for the introduction, Nathan. I'm delighted to be here. This is my first time being at this conference and presenting at this conference, and I'm delighted to be talking about some of the work that we do up at the U of S Ergonomics Lab to a room full of vets. This is going to be fun. So first, I want to acknowledge our research team. I will be talking today a bit about some of what's already known in this area of musculoskeletal disorders, or MSD, among vets. But I'll also be talking about some research plans that we have coming up and some ways to get involved in that research. So I'd like to acknowledge Chris Clark, Murray Jelinski, and Nathan Erickson, who I think many of you already know. And they are vets that are working with us on this project. Dr. Brenda Bath, who is a physical therapist and a faculty member at the College of Medicine up at U of S. Zhaoqi Zheng, who is a research assistant on this project, and we're all working together on this issue of musculoskeletal health. My first introduction to this topic, and I'll admit I am fairly new to it, came last June when I was at an agricultural health and safety summit, and I gave a short talk on musculoskeletal disorders and some of the opportunity that we have in research and in intervention to improve musculoskeletal health among workers in agriculture and beyond. And Chris Clark came up and introduced himself. We shook hands. He told me about some of the issues of musculoskeletal disorders and symptoms among vets. And then he told me where his hands had been. And that was my first introduction to this topic. So what is ergonomics? When I first arrived in Saskatchewan and told people I was an ergonomist, I think a lot of people heard agronomist, because there are a lot of agronomists in Saskatchewan, but I study ergonomics, so ergo for work, nomics for study. This is the study of people doing their jobs and ways to make that more efficient and healthier. At the U of S Ergonomics Lab, we have lots of great equipment, and we study in lots of different heavy physical industries. Ergonomics, the term does get used to describe office workstations, computers, desks, chairs. That is ergonomics, but it's not just chairs. So some of the things that we do, let's see if I can use a laser pointer. So we bring some of our equipment out to the field, out to farms, and we have measured whole body vibration from machinery, from all kinds of agricultural machinery. I've also done projects of baggage handlers at airports. They have a physically demanding job, as you can imagine. And we're currently doing a study in the swine industry, which is looking at the risk factors for carpal tunnel syndrome from different types of vaccination equipment. So we're looking at how different injection tools can affect the health of the workers, especially their lower limb health, so trying to prevent carpal tunnel syndrome in that group. We have lots of great equipment at the U of S Ergonomics Lab, so we're able to measure force and pressure. So you see some sensors up in that picture. We're able to measure muscular force, muscle activity through EMG. We have a lot of portable data logging sensors that can measure posture, movement speed, and we're able to do this in a very quantitative, objective, and state-of-the-art kind of way with the equipment that we have. So really lucky in that respect. I thought I would take an informal poll and see, just in this room, what we already know collectively about some of the risk factors and some of the symptoms that might be in this group. So how many folks in this room have conducted a bovine rectal exam, let's say in the last 6 months? Hands up. Okay, that's a lot of hands up. That's awesome. So clearly it's a prevalent work-related exposure. How many of you have had neck pain after conducting these exams? Hands up if that's you. Okay, and then the last one, how many with shoulder pain? All right, so more hands. I know some of you are still eating, so you may not be raising your hands. Some of you, your shoulders might be too sore to raise your own hand. So that's another thing to consider, that shoulder pain and neck pain can have impacts beyond just the task, just the work tasks. So talk a little bit about, I mentioned that there had been some research done already on this topic, and there is a little bit out there, mostly survey studies. But this first one will looks at shoulder pain, shoulder symptoms in the last 12 months, so 12-month prevalence. If you were to guess who has higher rates of shoulder pain, would you guess it's veterinarians or mixed occupations? It's the vets, right? That's probably not a surprise to the folks in this room. By a wide margin, the rates of shoulder pain much, much higher in vets than in the rest of the working population. Another way to look at the impact of musculoskeletal disorders is, how does it impact your work? Is it interrupting your ability to do your tasks? So let's say that we compare the vets to an occupation that is more physically demanding on average than everyone in the working population. So who do you think has more interruption of their regular work-related activities, vets or Saskatchewan farmers? Those farmers? Okay, a little, here, whispers on both sides. For this one, it is still the vets. So the farmers do have a lot more interruption of the work tasks because of musculoskeletal pain than the average working population does, but vets are higher even than farmers when it comes to this interruption of their activities. And this...
All veterinarians or large animal veterinarians? Or?
Both of these last ones were all veterinarians together. But that's an interesting point because the tasks are different between small animal and large animal vets. So you can imagine that focusing on this group might give a different result. The impact of these musculoskeletal symptoms aren't just the pain that you feel, but the impact on folks' quality of life. So if you have shoulder pain after doing your job all day, you come home, you may not be able to lift up your kids. You might not be able to carry your groceries inside. And if it's really severe pain, you might have trouble washing your hair or raising your hand at the presentation. There's also an economic impact which we shouldn't minimalize. It's not a trivial impact. Impeding work activities means you're not able to do the tasks that generate revenue for yourselves and for your businesses. The musculoskeletal disorder does lead to work absence, so sick days or time loss, in about 25% of large animal vets. So this one is specific to large animal vets, and that's a lot. So that's a lot of people that are missing days of work for something that usually we think of as being preventable. The end result of this, of all of these impacts of the musculoskeletal symptoms, is that folks may leave the profession. So they may ride off into the sunset and retire early. They may take on different roles within their practice. They may retrain into another job. But this can have big effects on one's quality of life, their economic ability, and their ability to do the profession that they've trained for. So it's musculoskeletal disorders are not a trivial thing in terms of impact. One of the older studies that I was able to find on this issue is about 20 years old, and it was written by an orthopedic surgeon in Regina named Dr. Aylesby. And so it's an older study. It's a case study, so it's not a super high quality study, but there is some good information there. So it gave an idea about what some of the work tasks are like. So it's one of the first descriptions in the human health literature about what a rectal exam is like and the positions that vets reported getting into. Talks a bit about the workload, so the idea that there's lots and lots of these rectal exams being performed. But the case study describes a couple of vets that came into the clinic reporting shoulder and neck pain on their dominant arm. And this was pain that early in their career would go away during the quiet season and then return every year. And every year that it returned, it was worse than before until the point that the pain never went away. It was a year-round symptoms for them. Most of these folks, or the two vets that are described, had normal range of motion in their shoulder, and they didn't have any vascular disorder related to it, but they did have neurological symptoms to the point where they had muscle wasting in their dominant limb that was performing these tasks, along with these pain symptoms. So the hypothesis from this study was that there is traction on the cervical plexus coming from C5, C6, C7, kind of resulting from this stretched position. There wasn't any actual quantitative assessment of what these tasks are. This was based on vets' descriptions. But probably many of you can recognize some of your own activities and your own tasks in those descriptions, and maybe some of the symptoms as well. Although there wasn't any kind of quantitative evaluation of what the tasks were, there was a suggestion that shorter veterinarians are at higher risk. And Dr. Aylesby also came up with some recommendations. So the first one, keep shoulder flexion between 20 and 25 degrees. And I'll show you what that looks like. So this is the range of motion for the human shoulder. So the range of motion is pretty large. This red line shows 20 or 25 degrees. So what this recommendation is, keep your arm down here while you're doing your task. The next recommendation, keep the neck forward, so in like this, rather than laterally flexing. So rather than moving your head to the side, tuck your chin in. So we can think about that one. The next one, consider using a stool or a platform, especially for smaller practitioners and especially for larger animals. So we can consider that as well. When we look at this advice that wasn't based on actually going out and looking at the tasks, we need to ask ourselves, how realistic is that? And you hear some chuckles in the crowd and we think, maybe not that realistic. I'd love to meet the person who can conduct their exams with their arm never going above this ankle. The other thing to consider is, well, if it wasn't based on quantitative assessments, on ergonomic assessments of what the task is, then what was it based on? So mostly this was kind of based on hypothesis, or kind of educated guesses based on the anatomy of the human shoulder. So I know that everyone in this room knows way more about bovine anatomy than I do, so I won't presume to tell you about bovine anatomy. I will talk a little bit about human shoulder analogy, and just to contrast with the shoulder of the cow and how that's different. So a quadruped shoulder is really built for stability and for weight bearing, while a human shoulder is built for mobility, moving all around, reaching to do the tasks that humans like to do with their hands, which is lots of things. So where a quadruped shoulder, it's a ball and socket joint, kind of analogous to a human hip, but a deep glenoid cup, and the humeral head fits into it. Whereas the human shoulder, very shallow glenoid fossa, the humeral head about 4 times as large, and so it gives it lots of room for articulation, but it's not a very stable joint as a result. So there's this trade-off between getting a lot more mobility, but being a less stable joint. And one of the results of having this very spacious, roomy human shoulder is that there are some vulnerabilities when it comes to impingement because of the positions that the shoulder can get into. So where the abduction for a quadruped might be sort of maybe 30, maybe 40 degrees out to the side, for people it's no problem to abduct out to 90 degrees and then go all the way up. The top image here shows how the acromion of the shoulder blade comes over to the top to meet the clavicle, and where these meet forms a bony arch, the acromion arch, and the rotator cuff tendons go through that. Because of the positions that the shoulder can roll in, and how the humeral head can come up and close the bottom part of that space, we end up having a unforgiving bony tunnel, which can get smaller. And if there's any inflammation inside there, then there's nowhere for it to expand to, because it's a bony tunnel, a bony arch. So if you get inflammation, gets impinged, more inflammation, and you end up with this kind of cycle. The GIF that's playing on the lower part of this slide shows a clinical exam that is used for eliciting impingement in the shoulder. So this would be specifically, we look at supraspinatus tendinitis, or an impingement of some of the rotator cuff tendons. But if you bring your arm kind of out, abduction and flexion kind of midway, internally rotate the shoulder, push down a little bit, and then stretch your neck, this clinical test to elicit impingement starts to look a lot like what a regular work task is. So we can see that probably there are likely to be some risk factors present in tasks that are very commonly done in large animal vet work. So there's a number of things that we do know about musculoskeletal disorders in vets, but there's still lots of things we don't know, and some of the most important things we don't know is how do we fix it. So the prevalence of MSD is clearly high in this group, but some of the studies that we're drawing that information from have low response rates. They have non-standard outcome definitions. Some of them do, but a lot of them they're not using standardized and validated tools to describe what the symptoms are. And where there is any measurement or discussion of risk factors, it's usually relying on self-report, which means that the researchers need to know to ask the right questions to get the information about what the exposures are. And that means you need to know something about the tasks, which that may not always be the case given some of the advice we've seen from some of the human health-focused folks. Musculoskeletal disorders in vets seem to be related to work tasks. There's, at least intuitively, we can see that that's likely to be true, but there has never been a published ergonomic assessment. No one has ever gone out and measured the work tasks that we could find in the literature anyway. There's also no study linking measured exposure to musculoskeletal disorders. So I feel pretty strongly that link is real, but there isn't actually firm evidence demonstrating that that's so. And that all of that together means that there's not a lot of evidence on which to base recommendations or interventions that are going to be realistic and effective in real life scenarios, because no one's gone out and taken a look at it. So when you are a carpenter and you've got a hammer, everything looks like a nail. And when you're a researcher, everything looks like an opportunity to conduct a study. So when I heard about this issue, I thought, I know what the big hope for this group is, to develop a research plan. And the first thing to do would be to collaborate with veterinarians and make sure that any recommendations that come out are reasonable and applicable. The next thing to do would be to determine the scope of the issue in Western Canada to make sure that we're understanding in this context what it's like, not just in Sweden, not just in the US, not just in Australia. Someone needs to go out and assess ergonomic tasks using state-of-the-art methods, so actually quantifying exposures, and that's the type of thing that we were able to do with the type of equipment that we have at the U of S Ergonomics Lab. We want to develop prevention strategies, and then we want to go out and test them to make sure that they actually work in these scenarios, so that any recommendations that we float out there, we have a high confidence that they're likely to work for folks and have an impact on health. So we're going to start at the beginning, of course, and these first two steps are things that we'd like to invite you to participate in and collaborate on, and we invite your partnership on these. So the first will be to develop a stakeholder collaborative group, and almost all my research studies have a stakeholder advisory group. These are a collaborative group of folks that know the industry, that know the tasks, that help direct the research and interpret results. So this helps keep the results grounded, realistic, and applicable to real life scenarios, so we're not delivering a ivory tower message that is disconnected from real life. Usually these groups meet once to twice per year, and you're invited to participate. So if this is a topic that calls to you, if it's something that you're interested in, please feel free to contact me. My email is on the slide, and I've also put some descriptors of the study with contact information up at the front desk, so feel free to grab those at registration on your way by. The next thing we'd like to do is conduct a study of WCABP members. So we are planning a postal survey that will go out with the March newsletter, and so you can anticipate that coming into your mailbox in the spring. You'll have the option to fill it out on paper or online, and the questions ask about your work, about any symptoms you may have, what the impact that is on your work and quality of life, and then any current strategies that you have to mitigate symptoms. So we want to hear about all these things. If you have any questions or suggestions about either the survey or the stakeholder advisory group, please feel free to contact me. I'd welcome your collaboration on this. With that, that's the end of my talk. I'll acknowledge the Western College of Veterinary Medicine and the Canadian Centre for Health and Safety in Agriculture as the homes of the research team. And I've listed up here also the lab website, so you can read a bit more about this project and some of the other projects that we have going on. Happy to connect with folks on Twitter. I think would be a benefit for me to follow some vets and find out a bit more about your daily work. And my email once again. But I think we have time for questions, if there are any.
Any questions at all for?
Quiet group.
Oh.
Ow.
Just one.
Oh. Ready for it?
Oh, nice one.
Last year water dumped over, so.
Oh.
Just wondering too, with the advent of, with preg checking, lots of ultrasound usage, are you looking at that too and how we're utilizing it and how it affects shoulder, neck, and back?
Good point. Thanks for suggesting that. It is one of the things that we're also asking about on our survey. Both the amount that people are using ultrasound, what conditions they're using ultrasound for, and whether there's any specific ultrasound symptoms that result from that. One of the things that we have noticed with other new technologies or interventions, you might be passing the buck from one part of the body to another. So it might be that it's not a shoulder impingement problem anymore. Now it's a static back load from bending, or even a wrist issue from pressing in. So it's a good question.
Just kind of adding to that a little bit, it'd be interesting to know if there's other vets here that are having issues as far as carpal tunnel type syndrome from the probe that we use for the ultrasounds, and if there is some sort of way of developing a probe that is handled in a different way to alleviate that. Yeah,
that's a good question. It's some years ago I worked on a study of human ultrasound techs, and one of the challenges in wand design was because it gets handled from so many different angles, it's very difficult to develop a perfectly ergonomic handle because it would provide only one angle of. So if you put a bend in the handle, sometimes that can result in people, because that has made it less flexible in terms of ways to grip the wand. Sometimes it can add problems. But it's a good. Oh, sorry, you've got a follow up. I so far have only seen the one used for swine preg checking. So. Mm-hmm. Mm-hmm. Yeah.
I don't know of anybody who could use it in any other way than holding it. When the butt end of it sits right in the palm of your hand.
Mm-hmm.
So that's where you wind up with pressure in that carpal tunnel
So you'd have contact stress, which is a risk factor for carpal tunnel. If there's a lot of pressure, so a lot of squeezing pressure, force is a risk factor, and then posture, which you've already pointed out. So that's 3 big risk factors for carpal tunnel syndrome. It's good that you mentioned that, and I think it's the type of thing that we'll need to be aware of and probably will chase down. Thank you.
Any other questions?
What are some things that we could do right now that reduce
So the question is for advice for what folks can do right now that to reduce their risk for musculoskeletal disorders. Some of the things that I can say as an ergonomist that I'm fairly confident will work might not work in your situation. So the advice that Dr. Aylesby came up with is the type of advice that is very likely to minimize symptoms, but without, I feel a little underprepared to answer that question now in a way that is realistic and linked with the tasks. I feel like has already been pointed out, we're going to need to go out, take a look at all the tasks, take a look at the equipment, take a look at the working situations, and make sure that our advice is really grounded. So I'd be hesitant to give any specific advice, but if you want to try out the 20 degrees of flexion, shoulder flexion, let me know how it goes. Yeah. Any other questions? No? All right. Well, thank you very much.
So the next sessions will be starting fairly shortly. So if you're in the dairy session, just wrap up. Sorry, I guess you got a little bit of time, but make sure you get all you want for food and get over there on time. Thanks. Bye.